Morphology of apoptotic cell. So we'll discuss the morphological features of apoptotic cell. First is cell shrinkage. The cell is smaller in size, the cytoplasm is dense, and the organelles, though relatively normal, they are more tightly packed. So the important features are cell becomes small, cytoplasm gets dense, and organelles get more tightly packed. Now cell size is small. This is in contrast with necrosis, because there is swelling in the cell, but here there is cell shrinkage. So this is a very important point you must note. Then chromatin condensation is another feature. It's the most important, most characteristic feature of apoptosis. The chromatin aggregates are formed, and they are formed peripherally under the nuclear membrane into dense masses of various shapes and sizes. The nucleus itself may break up, producing two or more fragments. Other features are formation of cytoplasmic blebs and apoptotic bodies. So apoptotic cell first shows extensive surface blebbing, then it undergoes fragmentation. So what happens is, if this is the cell, then these blebs are formed from the surface, and then they leave the cell, apoptotic bodies are formed. Fine, that is, fragmentation occurs and ultimately apoptotic bodies are formed, and these are membrane bound. They are composed of cytoplasm and tightly packed organelles with or without nuclear fragments. So there may be presence of nuclear fragments, or there may not be presence of nuclear fragments. Phagocytosis is another important feature, very important feature. After, this is a very important feature, chromatin condensation, but you must also note that phagocytosis is very important, because this is responsible for the rapid ingestion of the apoptotic bodies. They are rapidly ingested by phagocytes, and these are degraded by the phagocytes' lysosomal enzymes. If we do the histological examination in tissues which are stained with hematoxylin and eosin, the apoptotic cell appears as round or oval mass, intensely eosinophilic cytoplasm is seen, and fragments of dense nuclear chromatin is seen. Remember these 3 points, because in few minutes we are going to see those in the picture. Because the cell shrinkage and the formation of apoptotic bodies are rapid and the pieces are quickly phagocytosed, hence considerable apoptosis may occur in tissues before it becomes apparent in histological sections. So you can realize how rapid it is. So this picture I am talking about, you can see this is the apoptotic cell. This picture is showing the apoptosis of an epidermal cell in an immune reaction, and you can see the size of the cell, it is reduced, and the cytoplasm is brightly eosinophilic. See how dark it is. It's looking bright pinkish, brightly eosinophilic, and you can see the nucleus, it is condensed. So what features we can see? Reduction in size, brightly eosinophilic cytoplasm, and condensed nucleus. So this is the summary of everything. This is a normal cell. You can see there is condensation of chromatin, the formation of membrane blebs, and then these blebs, they form apoptotic bodies. After the fragmentation occurs, the cellular fragmentation, formation of apoptotic bodies. So this is basically apoptosis that is being shown in a flow chart. And the phagocytes, ultimately they ingest the apoptotic cells and the fragments. So apoptosis part 2 is completed. That was all about apoptosis. If you have not seen the part 1 video, you can get the link in the description. apoptosis topic is very important in pathology, and this is also important for the exams, be it the subjective exams or the MCQs, and especially the mechanism, the extrinsic pathway, the intrinsic pathway, right? So if I list down, there are important questions that can be from the pathways of apoptosis. Can be extrinsic pathway questions, can be from extrinsic pathway or intrinsic pathway, right? Then the morphological features. The morphological features which are seen in apoptotic cell, that can come in the form of picture based question, or this is important. And you should also know the examples of pathological apoptosis and physiological apoptosis, right? This is also very important. And the mechanism, obviously it's very important, not just the name of the caspases but also the mechanism, how apoptosome is formed, and what actually is death domain, and all these things. It's very important. So if you want to get the clarity, you can watch the part 1 apoptosis video. The link will be sent in the description. Thank you.